Lauren. Today we're going to take a photo tour of your mouth. I'm going to go over this laminate with you first. I just want to show you, so when we take these pictures, then I can go over the condition of your fillings with you so you have an idea of that. Excellent condition is when all the edges are sealed. It's pretty much when the filling's placed the same day, everything blends very well. You can barely tell that there's a filling there. As we get down to the good condition, all the edges are still sealed, no staining present. And then as we get into the fair and poor categories, that's when we start seeing some problems. In the fair, you're going to start seeing some openings around those edges, some staining with the possibility of some decay. And then the poor category, as you can see, there's more openings around the edges, some cracks in the tooth there, some staining and decay, and some cavity present. Okay, so let's lay. Do you have any questions about that?
Oh, can you explain maybe more the difference between the fair and the poor?
Okay, yes, in the fair, that's something where there's a possibility of decay. There's not really any cracking, there's some staining, but as we get into the poor, there's definitely more cracking. We're actually getting our little explorer under there, and we're actually getting snagged there, and,
okay.
And then we can feel some stickiness there. Okay, we'll go ahead and lay you back and get those photos then. Okay, I did take some photos. You do have a really good filling here. As you can see, all the edges are sealed. There's nothing that needs to be done with that tooth, but we do have some other areas of concern that I brought up here. As you can see, these two fillings are in fair condition. We're starting to see some opening around those edges. That could be a problem with decay. So I think that we need to go ahead and just replace those fillings as a solution with a nice white bonded filling. And this tooth down here is actually in poor condition. As you can see that there's some filling material that is actually broken out of the tooth there. There's some cavity in there. And with the size of that filling and the amount of tooth broken off there, the solution would be to do a crown on that tooth. Okay, any questions about the treatment? I'm going to get Dr. Ritzi to come in and take a look at everything.
Great.
Okay.
Hi. Are you Lauren?
I'm Lauren.
Hi Lauren, I'm Steve. Nice to meet you. How's Lauren doing today, Jay?
She's doing well. We do have a couple concerns. She has some fillings in there that look really good, but there's a few problems that I brought up here today on the screen. We took some photos of her teeth. Tooth number 19 and 20 are in fair condition. There's some openings starting to be around those edges there with the possibility of some decay. I'm just worried about the consequence of decay growing in those areas, and the solution would be just to replace those fillings. And then tooth number 15, she's actually has some filling broken out of that as the problem, and some decay getting in there, and it's such a large filling. The solution would be to do a crown on that tooth. So I'll just have you take a look at those.
Sure, thank you.
Thank you.
You take a look for you, Laura. Oh. That was a quick exam, wasn't it? Jenny's absolutely right. There's a few problems in your mouth. Down here, there's teeth numbers 19 and 20, which are right here and here. The problem here is you have two teeth that the fillings are getting kind of on the older side. They've done well for you. But between the filling and the tooth, the seam, there's a gap. And we're starting to get probably some leakage in there, some cavity forming there. The risk of letting that continue is, again, the cavity kind of gets bigger. Maybe a tooth chips on you, maybe some pain. The solution, Jenny's absolutely right, is I would go ahead and replace these old fillings with new bonded white fillings, and I think that would work real well for you. There was another. Do you have any questions about those two teeth?
You explained it quite well. Please continue.
Okay. Tooth number 15, which is right here. Okay, this is this tooth up here. Again, Jenny's right. There's a tooth there. You're missing some of the tooth. Some of the tooth is broken off, which means that there is a gap between, again, the tooth and the filling. I think there is some cavity in there. My instrument got stuck in there. But the good news is we can fix that tooth. So the problem is, yeah, some of the tooth is broken. If you leave it like that again, you'll get more material stuck in there, and you'll get a bigger cavity. Maybe some pain, discomfort, maybe some swelling, infection. Maybe even more of the tooth will break off. But we can help you with that. And again, Jenny talked about a cap or a crown, and those go around the teeth. They add support to the tooth, and that would be the solution for that. I think you do real well with that too. Do you have any questions I can answer for you?